Yeah, 1 second. Okay, and you Vanessa. Yeah.
My anxiety,
Like what?
He wants to balance it out.
Got
Wants
it.
us to look
Good, and so then they become.
Is that better?
Here, you come in, and you two maybe more in front of that. You go a little more that way.
Okay.
And you go a little more this way. There we go.
Balance.
Buenos dias.
Good morning. Good morning.
It's great to be here. My name is Vanessa. I am the CEO of Alliance for Better Community, and I also have the privilege of sitting on the board to Planned Parenthood. I'm here, and I want to thank everyone for joining me, supporters, leaders, elected officials. I'm here this morning because we are here to sound the alarm that President Trump's plan to defund Planned Parenthood health centers nationwide will lead to a public crisis. I'll be switching between English and Spanish, so give me a minute. Buenos días y bienvenidos a todos al Centro de Planned Parenthood. Mi nombre es Vanessa Aramayo y soy la presidenta de Alliance for a Better Community y también sirvo en la mesa directiva de Planned Parenthood. Quiero dar las gracias a todos los oficiales elegidos, igual a los líderes y a los que están apoyando a este centro que es tan vital e importante para nuestras comunidades. Estoy aquí porque queremos hablar de lo que está haciendo el presidente Trump en cortando los fondos para el centro de Planned Parenthood y el crisis de salud pública que esto va a causar. More than 1.3 million patient visits for birth control, cancer screenings, STI testings, annual exams, and preventative care are at risk in California alone. Joining are Los Angeles County leaders who understand the dire threat that the recent budget reconciliation bill poses to Planned Parenthood patients across the country, including right here in California. Más de 1.3 millones de visitas de pacientes para poder ver de cáncer, para poder hacer exámenes, para poder tener sus citas de cuidado preventivo están a riesgo aquí en el estado de California solamente. Ahora con nosotros están varios líderes del condado de Los Ángeles que entienden esta amenaza por estos cortes y el efecto que le va a hacer a Planned Parenthood y a los pacientes sobre todo el país y también especialmente en el estado de California. Let me first introduce Speaker Representative Sydney Kamlager-Dove, U.S. Member of Congress and Board Chair, Planned Parenthood, Los Angeles.
Thank you, Vanessa, and thank you to all of my colleagues and fellow warriors on behalf of women, children, and families who need health care across Los Angeles. My name is Sydney Kamlager-Dove. I'm the Congresswoman for the 37th Congressional District. We are in my district right now, and I am a board co-chair for Planned Parenthood Los Angeles. You know, in the words of Speaker Emerita Nancy Pelosi on the day the Dobbs decision came out, I'm not going to say good morning because it certainly is not one. We are here because the Trump administration and my Republican colleagues in the House are doing all they can to make it more difficult for women to access health care, for women to make decisions about their bodies, for women to be able to get pregnant safely, and to be pregnant safely. I just came back a couple weeks ago from voting on a horrible reconciliation bill, an ugly bill that would do so many things, including cut almost $1 trillion of Medicaid. That would mean that women, children, girls, men, everyone who was on Medicaid will be fighting to access health care. And we know that organizations like Planned Parenthood is a Medicaid recipient. We also know that when abortion is on the ballot, it wins. across cities and states across this country, when abortion has been on the ballot, people have showed up, they have showed out, and they have voted to protect reproductive health care. So what did this administration do? They put a pernicious, dangerous provision in this reconciliation bill that would prohibit federal Medicaid funds from going to Planned Parenthoods. We know that 52% of adult women across this country are on Medicaid. That number is exponentially higher in Los Angeles. And when women, young women, adult women are going to Planned Parenthoods, they are asking, looking for help about the reproductive health care. They're trying to get cancer screenings. They're trying to handle STIs and STDs. They are trying to do what everyone else is trying to do when they go to see their healthcare provider. And they come to a Planned Parenthood because the providers here are providers that they trust. When they are trying to get prescription medication on time without having to wait for months, they are coming to a Planned Parenthood. When they are in an abusive relationship and they are trying to get health care that is safe, that will keep them safe, they are coming to a Planned Parenthood. And when they live in another state that has totally disregarded their rights as a woman, they are finding their way to a Planned Parenthood. It is more than just about abortion, and it is also about abortion. It is about reproductive health care that is administered safely, appropriately, with compassion, and affordably. And what really sticks in my craw is I actually have a Republican colleague that I served with who was in need of this very kind of care and lives in a state where she helped make it illegal to get this kind of care. And because of her privilege, because of her access, she was able to go around the law to get the care that she needs. This is care that every other woman should also be entitled to. And this Republican Congress, this Trump administration is making it illegal and dangerous for providers to offer care, for women to seek care, and for family members to work with their loved ones to get care. I'm going to say this as well. It is not just about patients, it is about jobs, and it is about access. When you are talking about closing down community clinics, urgent care centers, and hospitals, when you are talking about getting rid of jobs that help keep Los Angeles safe, that is when you know that we are in the crosshairs. That is why we are having this press conference, because we are sounding the alarm about what is at stake in our city, in our county, and in this country. And we are not going to lay down without a fight. So now I want to bring to the microphones Jody Hicks, Executive Director of Planned Parenthood Action of California. Oh, was I supposed to say that?
That's fine.
Okay.
Thank you. Thank you, Congress member. I want to start out by just saying thank you to everyone here today and the importance of Californians understanding what just happened in HR 1. I can't shout it more on what just happened with Planned Parenthood. I am representing Planned Parenthood affiliates in California, representing all 7 affiliates that have over 115 health centers throughout the state, including Planned Parenthood Los Angeles. So what did HR 1 do in defunding Planned Parenthood? I think it's important to understand no federal dollars go to abortion services right now. That's already the law. That's already been decided. We can talk on a different day how unfair that is. And how it harms access to specific services. But that's already the law. What they did in this bill is described Planned Parenthood and said any entity that is a Planned Parenthood can also no longer get those federal dollars. So we're talking about cancer screenings. We're talking about STI testing. We're talking about birth control. For 2 affiliates, we're talking about primary care. We're talking about prenatal care. We're talking about women's health. and how important that is when we see over 1 million patients, 1 million visits a year, and what that does to the footprint of people getting reproductive and sexual health here in California in taking away those funds. And so people in California should be so angry. This is a state where we have decided we value reproductive freedom. We passed an initiative to ensure that those rights are enshrined in our very California Constitution. And what did they do? All 9 Congress members, Republican Congress members, voted against the constituents in California, against the voters that have overwhelmingly spoke through their vote how important reproductive freedom is and took away access. Essentially, what they've done is politicians in Washington have imposed economic sanctions on a state like California because of our values and reached into California and decided that they will take away those funds. And it disproportionately impacts Californians more than any other state across the country because we have those values, because clinics like this health center here today serves over 80% Medicaid patients, because we value those underserved patients and ensuring that they have access to health care. That's what that bill is attempting to do. Now, you've heard we will fight back with every tool that we have. Planned Parenthood Federation of America, or of America, on behalf of all of its members, I'm so used to talking about California, has sued. And our message is very clear that everyone deserves access to reproductive and sexual health, including people that go to Planned Parenthood health centers, and they should be able to continue to go. We are awaiting to see what that order says. We're waiting to see if the defund goes into effect here in California. But until that time, what's important is that everyone raises their voice, and everyone should be angry, and everyone and insisting that this never happens again. And every time, this is unfortunately the result of not having Roe v. Wade. We're in the 3rd year out, and without that protection, they can now do things like economic sanctions. They can now reach into states like California and try and take away protections that we fought so hard here to have. And so everybody's voice is important. Every tool that we have to fight back is important. But it's important to understand the impact and what they're trying to do here in California, and we shouldn't take it lying down. We'll continue to fight back, and Planned Parenthood will continue to serve patients, because that's what we do. And we'll stay here, and we're here for good no matter what. With that, I want to introduce our next speaker, who is a champion, and I miss her in Sacramento, but you all in Los Angeles very lucky to have her, Supervisor Holly Mitchell. Thank you.
Thank you. Good morning, Los Angeles. First of all, Sue, I want to acknowledge you, your board members, and your staff. You know, to operate in your place of employment under a constant state of attack, year after year after year, has a weathering effect on you. It wears you down. And so for you all to continue to stand up, fight after fight, whack policy after whack policy, and provide these services to my constituents, my family, friends, and neighbors, let me thank you, because we know it's not easy. I was standing here in this area thinking about all of the pressers I've been to and the bill signings I've been to. And frankly, as I think about it, it's been more good news than bad. But today, really, I think for me, represents an all-time low. You know, I have the privilege, along with Dr. Barbara Ferrer, our amazing director of LA County's Department of Public Health, of fighting for a safety net, a provider of last resort, which is what the county is, to make sure that every Angelino has access to what they need to survive, if not thrive. And when I think about the numbers in the 2nd district alone, each of our supervisorial districts represents about 2 million people. 850,000 of my 2 million are Medicaid dependent. When I think about the county is divided up in what we call SPAs, service planning areas. And when you look at the way we divide up LA County, it looks a lot like the nation. There are SPAs that have great access to healthcare services, and there are SPAs that are basically healthcare deserts, where far too many of my family, friends, and neighbors, your family, friends, and neighbors, don't have access to the health services they need. So when you layer on top of that reality, the mean-spirited, racist, sexist, classist policies coming out of this federal administration, it will only get worse. So let's break down what it means to eliminate Medicaid. Based on the numbers of people here today, all of us have a family member or a very close friend or neighbor who is Medicaid dependent. That means their children won't have access to their immunizations to go back to school. With the mean-spirited, sexist, frankly, cut to Planned Parenthood, what does that mean? That people can't do what the name suggests, plan their pregnancies, go into pregnancies healthy because they've had access to important prevention and prenatal services. I'm not going to ask you to raise your hands how many of us have relied on Planned Parenthood at some point in our life and still do, perhaps. That's what's at risk. I appreciate our Congress member, fighting for us every day, but helping us understand the national implications. Let me break it down, and to hear about what's happening statewide with all of our state affiliates, right here in our very own blue county of Los Angeles. The dire impact these cuts from Planned Parenthoods, the federal government's refusal to acknowledge the role they play, and our overall healthcare delivery infrastructure, to the Medicaid cuts. People will die. That's unequivocal. And we know whose responsibility that is. The Congresswoman talked about who she has served with in Congress. I served with a current member of Congress in the state assembly. This congressman represents a district in California that has the highest Medicaid population in the country. How you vote against the interests of those who elect you, this is supposed to be representative government, I fundamentally don't understand. To vote against the vast majority of the people you represent and their ability to access healthcare services, which I happen to believe is a basic human right. Stripping Medicaid funding from Planned Parenthood, again, isn't just an attack on clinics, it's an attack on people. Shutting down health centers threatens the well-being of Black and brown communities, low-income families, and countless others who rely on Planned Parenthood as their only source of care. For the 300,000 children under 18 in my district alone who depend on social services, reproductive health education, and services, these kinds of services are literally life-sustaining and life-saving. So we're talking real numbers, hundreds of thousands of people in LA County alone who will be directly and immediately impacted by these hateful policies. I'm glad to stand with all of you here to talk about what we're going to do collectively to try to restore a semblance of decency and humanity in our country, our state, and our county. And we're going to count on all of you in the media to help us spread the true message, the fact-based message of what that bill has done to all of your family, friends, and neighbors.
Thank you, Supervisor, for your steadfast leadership, and Congresswoman, always for your courage. Now it's my pleasure to introduce another courageous leader, an expert, a health policy expert who has been in the trenches, so to speak, and has been such an ally and a supporter of promoting and advancing our health, Dr. Farrar.
Thank you so much, Vanessa. for having me today. I too want to start with expressing my gratitude to Sue Dunlap, the entire PPLA board, and most importantly, the staff who every day show up. They're here. They're at the 25 other clinics. They're serving 260,000 patient visits a year. In spite of the threats, in spite of the heartache that patients are showing up with because of conditions in which they're living their lives, and in spite of an all-out attack by the government, the federal government, for whom we all pay taxes to, is front and center in the work that they're doing every day. I hope you know that so many people like me stand behind you and your teams for all you're doing to make sure that people in Los Angeles have what they need to be healthy and to thrive. I also, of course, want to extend my deep gratitude to Supervisor Mitchell. Her steadfast commitment to justice and her courage to move forward the county's work, really with a laser focus on understanding how important equity is to all of us for ensuring that those who are going without have every opportunity to have us as their strongest champions for making sure that we right the wrongs that are historical in nature and continue to this day. And also, I want to acknowledge how wonderful it is to have Congressmember Kamlager-Dove in Congress. I know that must be a really depressing place to work on so many days. But you do bridge the gap between policy and the lived experiences of our communities. And I'm grateful that you're willing to speak out on the most fundamental threats, not only to those that are most in need, but to our democracy. And of course, I want to also acknowledge all of our other speakers. I especially want to appreciate Aneda for her willingness to share with us today. Her courage in telling her story reminds us of the profound human impact behind these disastrous policy decisions. For me, this decision to restrict funding for Planned Parenthood isn't just a policy shift. It is a direct threat to the health and well-being of hundreds of thousands of people across LA County. And I want to note that this is now the federal government telling people who their provider can and cannot be. And that should be acknowledged, and we should all stand up and insist that our right to choose who we trust to take care of us cannot be dictated by the federal government. I want to also note that Planned Parenthood works alongside of us in 30 schools across LA County, where high school students are the beneficiary of PPLA's deep commitment to this community. They work alongside public health teams to ensure that young people have safe, supportive access to health education, mental health, and reproductive care. These are students who, without this support, would otherwise go without services. Trust, respect, and continuity of care are what allow people to seek help early and to stay engaged in their health. If this care disappears, people will be delaying treatment or going without entirely until it becomes an emergency. The consequences ripple out. Most importantly, poor health outcomes for those who are already experiencing the largest inequities in health. Higher costs and a heavier burden on hospital emergency rooms, alongside a deepening gap in health outcomes across our county. Public health is about making sure that everyone has the resources and opportunities for optimal well-being. And this happens only when we invest in systems that support prevention, access, and equity. Defunding Planned Parenthood severely undermines that goal. We must work together to ensure that policy decisions reflect the lived reality of people in this county. When we shrink the capacity of Planned Parenthood to continue their work, we're not just cutting benefits, we're not just cutting budgets, we're cutting lives short. Thank you to all of my friends here for your unwavering commitment to health justice and for believing that it's worth fighting for a future where every person has access to the care they need to live healthy, dignified lives.
Thank you, Dr. Kerr. And now it's my pleasure to introduce a patient of Planned Parenthood, Neda Ashtari, who's going to remind us of what these impacts mean on a day-to-day.
Hi, thank you for having me here to share my story. I am sharing as a Planned Parenthood patient who was a teenager with no place to go. I was on Medi-Cal, and what that meant at the time was I had insurance on paper, but in reality, I didn't have access to care. I just had a list of disconnected phone numbers, full voicemail boxes, and clinics that told me to call if they even picked up at all. So I learned to go without care, and usually that was okay, but when I needed birth control, I couldn't wait anymore. So I went to Planned Parenthood, and everything was so different. There was no paperwork maze, no months-long queue. They took my Medi-Cal and they saw me without delay. They explained my options to me like I had a right to understand them. And what they gave me was far more powerful than a prescription. They gave me control, the ability to focus on school, the confidence to shape my own future without being afraid of making one mistake and losing it all. So the next few months when I needed a pap smear, I went to Planned Parenthood again. For a lot of people, it's a routine exam. It's just 10 minutes. But for me, it wasn't routine at all because my mom had gone without access to screening. And so when we caught her cancer, it had spread everywhere. We lost precious time and we lost her. So when I was on that exam table at Planned Parenthood, I wasn't just there for a test. I was doing what my mom never had a chance to do. And I was taking control of my health before I had to fight for my life. So for people who want to reduce Planned Parenthood to headlines or politics, I want you to remember this. Attempts to defund Planned Parenthood do nothing but take away life-saving care from people like me. Planned Parenthood was there and gave me care when no one else would. They gave me access when every other door was closed, and they gave me dignity when I'd expected none. And that changed everything. Thank you.
Thank you, everyone.
Doctor, can we ask a question?
Sure.
You want to do it on the mic or?
Oh, sure.
Okay.
Whatever helps, yeah.
Trying to get your opinion of the federal cuts to the county budget.
Yeah, I mean, I've been very vocal about the threats with this new federal administration. Right now, there are three big ones. One is that big bill that just passed will, as you noted, decimate Medicaid. It also decimates food stamps and immediately takes away, it's eliminating a program that allows us to provide education around healthy eating and to supplement people's food insecurity by delivering surplus food to food pantries. So eliminating SNAP Ed makes no sense. Cutting back Medicaid is a fundamental threat to all of us. And the meanness of this administration is on full display. The president also proposed a budget that will go in effect in October once Congress deliberates, that will defund the Centers for Disease Control by 55%. We get about $900 million a year in federal grants here at the Public Health Department. If we lose 50% of that funding, it affects the fact that 60% of that money goes out to our community partners for them to provide valuable public health services throughout the entire county. We also have 1,500 employees that are funded with federal dollars. And most importantly, when we talk about defunding community partners and unfortunately doing workforce reductions, it means that there will be less life-saving public health services. This will affect our ability to track diseases, to do case finding, to allow people to get their life-saving vaccinations, to do emergency preparedness, which was cut by 50% in the proposed budget, to mount the kinds of campaigns we've mounted both when the pandemic hit, but also smaller campaigns against dengue, against measles. Our ability to be the public health department that this community deserves will be eliminated. We will be making tough choices with half the money we have about which services we're going to be able to provide and which services we'll have to forego. Thank you.
And one will assume that on the heels of COVID, that we all had a brand new appreciation for the role of public health. Perhaps not. Beyond what Dr. Ferrer shared, because you asked the question about impact to the county budget, we are getting updates from our CEO on a weekly basis because as the Congresswoman can certainly attest, so much of that bill was drafted and changed in the cover of darkness, passed and signed overnight. We're still trying to figure out the across-the-board impact to county departments beyond public health and healthcare services. It will be devastating. We're clear about that.
You know, I think one thing that the third threat is the new threat that was issued in a directive this week that says that our federal grants, when we do get them with the reduced money, can no longer support any work that we're doing with people who may be here without appropriate documentation. Public health does not distinguish. We serve everyone. And the reason for that is public health is the health of the entire public. Infectious diseases know no boundaries. Education about what you need to do to stay safe and what our communities need to do to be safe does not have boundaries. So having the federal government immediately issue a declaration and a directive that we cannot serve people who may be here without documentation will undermine everything that public health stands for.
And compromise everyone's health.
Nomás quiero compartir unas pocas palabras que dijo la directora del Condado de Los Ángeles de Salud. Esto es de que lo que está pasando hoy es una amenaza a la salud de la comunidad, el bienestar de la comunidad en un momento donde se ocupa más que en cualquier otro tiempo. Las mujeres y la comunidad de bajos recursos que trabajan no van a poder tener este salvavidas para la salud y para poder prevenir y también obtener la educación que se ocupa para tener una salud bien. Hay varios riesgos, igual a poder proveer y mandar el cuidado de salud. En adición de eso, también son las investigaciones, que son más de 900 millones de dólares que otorga el condado de becas. La mitad de eso está en riesgo. Y también es la amenaza que no se puede servir a la gente indocumentada. Nuestra comunidad, lo que hemos aprendido por COVID, es de que nuestra comunidad y los virus no discriminan. La salud pública es esencial y esto, los cortes que están haciendo, es una amenaza a esa salud pública. Gracias. Any questions? ¿Cómo no? Como compartió más antes la paciente, es de que aquí se hace varia educación sobre poder planear de tener una familia. Aquí son screenings y son exámenes para prevenir el cáncer. Aquí también se hacen mamografías. Son varios servicios esenciales para que una mujer, igual los hombres, puedan tener la información y el poder de hacer decisiones para cómo quieren planear su futuro y su vida. En muchos instantes, esa educación los permite seguir estudiando en el colegio, en la universidad o decidir cuándo queremos tener una familia. O sea, es esencial para hacer las decisiones que uno tiene que hacer, que son informadas.
What is your message to people accessing, Planned Parenthood and with, funding here? What would those resources look like? Where can people go next?
I'm going to let Sue speak to that.
Hi there. Today in Los Angeles, Planned Parenthood's doors remain open. We're here to provide care no matter what. And I really appreciate the supervisor and the congressperson acknowledging how important the work of our staff is. This is a moment that's very challenging for all of us, but for today, we're still in the fight. And our commitment to that fight is to take care of our patients no matter what. And our doors remain open and our hours remain unchanged here in Los Angeles, and I believe all across the state of California.
Sue or Jody, can you talk to me about the lawsuit and what that's supposed to do?
I'll
Yeah,
try.
sure.
I have a little bit of a throat issue. I realize that's not of interest to anyone. What the lawsuit is doing right now is it's put in place essentially a barrier. Think of it as a restraining order or an injunction. And it's creating an opportunity for us to continue to provide care as the lawyers step back and say to the courts, this is not okay. It is not okay to target Planned Parenthood in this way and make sure that people all across the country can't use Medicaid to choose their provider. The next step, which very well may happen today, we don't know where that will land. Our hope is that the restraining order lasts as long as possible and we're able to keep our doors and our resources flowing as they should, which is appropriate given how we all understand how the government is supposed to work. Our fear is that this may find itself in front of the Supreme Court, and we'll all be aware of that, and more to come. But for today, the lawsuit has blocked the inability for people to choose Planned Parenthood as a provider. So that's part of why I'm able to say here in Los Angeles, here across California, Planned Parenthood's doors stay open and we remain completely available to Medicaid patients and are really committed to putting our patients first as the courts take up this matter, which in my opinion should not be so complicated. We should all be able to choose our own provider. And in California and in Los Angeles, time and time again, we have voted for sexual and reproductive health care. We have voted for abortion access. The people of this community, the people of this state support access to Planned Parenthood.
¿Cómo estamos en español esa respuesta sobre el bloqueo que permite que las puertas se mantengan abiertas?
Because of the restraining order, we're able to stay open right now.
El caso legal permite de que las puertas se mantengan abiertas aquí en Los Ángeles, en Planned Parenthood de Los Ángeles. Los votantes han votado en el pasado para apoyar acceso a cuidado y también han votado para que una mujer tenga el derecho de hacer las decisiones ella misma. Entonces, por medio de la orden, hay una restricción para que la gente no todavía tengan la habilidad de determinar dónde pueden tener el acceso. Es muy importante de notar de que lo que están haciendo en esta administración es preveniendo la decisión a la gente por dónde puedan escoger su cuidado. Entonces, por medio de esta orden, por el momento, las puertas de Planned Parenthood se mantienen abiertas, el staff de Planned Parenthood se mantiene dedicados a poder servir a la comunidad.
Thank you. Thank you.
Thank you.
Next time you're
Oh, I hate talking.